The reason that a local public safety coordinating council really exists at its core is to approve the local Community Corrections Act plan. Now, it does so much more than that, and sometimes it's overlooked in terms of what it exists for, because it's really that congregation spot for a community to talk about the myriad of issues that face a community regarding the criminal justice system. Certainly our group has dealt with everything from sex trafficking awareness to homelessness, addiction services. We've really branched out to really try and make this a place where substantive conversations can happen. But for this purpose, it is driven by statute, and I need to present the Community Corrections Act plan. If it is approved by this body, it is then moved to be recommended by the Board of Commissioners. And at that point, we can go back to the state and say we have a locally developed plan. It is approved by our Board of Commissioners, and we enter into the continuing IGA with the state of Oregon. For parole and probation services, what we call community correction services in the state of Oregon, the funding goes through the Department of Corrections. It is allocated to each county based on a grant and aid process. Funding for community supervision services goes through the state, and they approve plans like this in every county. And this is the LIPSIC that that it is subject to approval with. Funding is allocated to each county based on a formula that takes into account the time and costs associated with supervising new, high-risk, medium-risk, and low-risk offenders in the community. A capitated rate is established, and counties receive funding based on the number of funded cases they have in relation to the state pool. Currently, Jackson County is set to receive 6.88% of the total state-funded caseload, and that is larger than our normal population, which is 5.2%, roughly. So we're 5.2% of the state population. We're 6.88% of the state-funded cases. The funding is to provide supervision, services, and sanctions for felonies and select misdemeanor cases. The select misdemeanor cases that are funded are drug cases that were previously felonies, and they receive funding. Currently in Jackson County, we receive quite a bit of that funding statewide. We have 14.5% of the state's population of funded misdemeanors, drug-related cases, and that population, that's 417 bodies that we're funded for on that. Those 417 people, 60% score out as high risk to reoffend. So we have a high risk population of drug offenders in our community. But I also want to mention that while we're here to talk about the community corrections funding and specifically what the state funds, it's important to note that our county does a lot within community justice to serve the criminal justice population. I'll talk today about that funded population, that 6.88%, that 2,450 bodies that right now, if you took a snapshot, are currently being supervised. But over the course of a year, our department touches many people's lives. You look at this graphic here, pretrial services will serve over 381 different people throughout the course of the year. DUII services, 2,869 different people over the course of the year. Community service will be utilized by 1,133 different people. Home detention, 294. The resource center, averaging 77 people per week. 4,004 people will be through that by the time the year's over. And then formal supervision, while we have 2,450 right now as a snapshot, we're going to serve over 3,291 when you count the total intakes that will happen over 2019. So it's important to note that that footprint is large, but it's not large in the sense that we're sending everybody to prison. It's not large in the sense that every one of these people will utilize jail. If I were to leave you with one thought today, I hope that it's that Jackson County has a robust and rich array of services meant to address the needs of our citizens at all different levels, and ideally at the lowest level of supervision that's required to safely have them serve the conditions of whatever it is that brought them into our system. So over the course of the next 2 years, we're set to receive $18.483 million from the state for community corrections services. Currently, how that's allocated within Jackson County, $3.487 million goes to the jail, $4.68 goes to the transition center, and supervision and services will receive $10.3 million over the course of the year. It should be noted that that is kind of the backbone of our funding, but it's certainly not the only funding mechanism for the services that we apply to our population here locally. And I'll get into that in a little more detail. Jackson County invests heavily in our local supervised population. We're not a county that says, jail and prison is our intervention for people who are justice involved. We don't just look at folks and say, well, if they're in need, we're going to send them to jail. We put $1.4 million per year to transitional housing, and we'll talk more about that. It's actually 1.468 of general fund dollars. So it's very important to this county that when we talk about public safety, it's the full array of services. We invest $40,000 a year in misdemeanor domestic violence case supervision. This was previously supervised by a VIA grant, but that population is so important, so high risk, and presents such a concern in our community that we supervise those with local funds. And then we also have another $260,000 to make sure that we administer a full range of correctional programs. And in addition to those local investments, which come from Jackson County, we also do lean on our clients, our supervised population, to make sure that they're contributing and paying their own way whenever possible. We'll have over $1.3 million in client fees to provide this full array of services. So, we do talk about it, but whenever possible, we're shifting the financial burden of incarceration off of the taxpayer and onto the clients. And the clients we work with on the adult level are often very talented. They often have the ability to go out and make good money with once they're stabilized and can get employment. And so we make sure that we ask them to pay their way once they start living that way. It's part of the accountability commitment we have. So we mentioned the idea that jail is one of the areas that we invest in locally. Funding's provided to utilize local jail space for felony and select misdemeanor offenders on community supervision who are sentenced to less than a year, folks who are revoked for less than a year, or people who are sanctioned for violating their supervision. And currently we have 68 beds dedicated to local control in our jail. The challenge is that within our community, it's one of those things that we definitely have a larger need for, given our supervised population and the people that we deal with on a local control level. So we mentioned that it's not adequate, and it negatively impacts the compliance with alternate sanctions, participation in treatment, and it doesn't allow our clients to stabilize before we transition them to an alternate placement. We utilize justice reinvestment funds, another state funding source, to station release assistance officers at the jail with the aim of maximizing the efficiency of current jail capacity while ensuring local sanctioning ability and court appearances by defendants. The jail is often the first stop for folks when we initiate that particular sanction, but we have the ability to move them within a continuum in our community. So the transition center is the second placement that we noted in terms of our largest investments of our Community Corrections Act money. And it serves as an alternative to jail for clients who are serving a sentence or a sanction. It can serve as a transitional housing location, when I mentioned that county investment that we have in that. And some inmates from the State Department of Corrections or Federal Bureau of Prisons are serving the last portion of their sentence at the transition center as they transition back to the community, allowing them to reestablish connections with their family, get employment leads, identify any treatment needs, and start to have a foot in the water as they transition in a more structured manner. When we look at the transition center, there's really 5 general populations that are served out there. I mentioned that it's an alternative to jail for local offenders. So they may start their sanction at the jail. If we were to do a 30-day sanction, they would start in the jail. We would serve it. We'd meet the administrative criteria for serving that sanction, and then we'd have the ability to move them within the continuum. And oftentimes the transition center is that continuum. If they're employed or they have employment prospects, we can put them in a work release program so that person either maintains their employment or gains employment over the course of their sanction. People leaving with employment while serving a sanction greatly reduces their risk to recidivate, and it decreases the long-term socioeconomic impact of a jail sanction locally. I mentioned transitional housing, and we have our own Mike Hescock who's going to speak in depth about that tonight, but it really is rare and special to our community that we have this resource. It used to be that a person would be released from jail or homeless in a community, and there weren't a lot of options. You'd see somebody getting released from prison with a hefty bag that was duct taped and maybe a couple bucks in their pocket, and people would utilize hotel rooms. Well, in Jackson County, we have the ability to have this structured transitional housing environment so that people who are unhoused, people who are precariously housed, people who are just in need of a place to stabilize before a treatment bed opens, we have that at the transition center. The completion of the prison sentence, that is something new with short-term trans leave, but also the feds have been using that process for decades. And the last part of their sentence on the federal level is done in what they consider in community like that. We have a residential correctional treatment center out at the transition center. Receives a lot of funding from Justice Reinvestment to run, but 15 beds dedicated to people who are in the justice system, who are on our caseload, who are looking for a longer-term treatment opportunity that will also include an employment component, housing, case management. And then supports for federal offenders. We're able to utilize space out there when necessary for local federal offenders who are on supervision in our community and needing to stabilize. They will use that as a sanction, but the purpose is to try and redirect and stabilize folks out there at the transition center. So in addition to medical, mental health, and support services, clients at the transition center may be eligible to receive work crew services. So they'll go out on work crew. And you might say, well, are they really receiving that? Is that something they're excited about? And I would argue they are. Folks are given job skills. They start to live on a schedule again. They remember what it's like to be productive in the community. They can look with pride at the work that they do. It offers us the opportunity to provide valuable infrastructure in our community while offsetting some of the costs of providing these correctional services, because the crews do receive revenue for the work that they do in our community. Folks could also receive work release. I mentioned that if they're employed or if they're eligible for employment. And we can work with job search skills and employment assistance. We have cognitive-based correctional treatment that's provided out of the transition center, and we can provide case management and transition planning. Case management can be something as broad as where are you going to live, what are your treatment options, how are you going to stabilize you with the health plan and with other food resources in the community, or it can be as specific as, have you ever created a budget? This is what a budget looks like. This will help you get there. So we can provide really structured programming to our clients around these valuable life skills that oftentimes they've lacked due to their criminal lifestyle. I mentioned earlier that we supervise cases based on risk. The risk principle for this purpose really refers to the likelihood or the probability that somebody will recidivate. We know that we can assess somebody and determine that risk, and when we do that in accord with the state rule that requires us to utilize certain tools, we will focus our resources on the people who are most likely to recidivate. We'll build case plans based on the items that they scored high on. So if they have a criminogenic need that's unmet, we'll make sure that we have services there to meet it, and we will work collaboratively with them to help them get there. But what we won't do is just use one-size-all approaches towards the clients we work with. I meant, if you look down here, it's kind of a gray scale, but there's a full range of interventions and sanctions that a person can utilize or that a PO can utilize while in supervision. A verbal intervention, and we often do skill building around that. Increased supervision, increasing the frequency in which somebody comes in, increasing the time that somebody spends with us. Enhanced treatment. I'll talk a little bit about our correctional grade treatment that we have in Jackson County that we've worked hard with our partners to help create. Community service, home detention, transition center. Some of our folks can be revoked to prison, and some of our folks can be sanctioned to jail or revoked to jail even. But I think it's really, again, if I could impress one thing, it's just that there is that full range, and we will utilize all of that. The other thing is that within a local control environment, we can often move people through that continuum upon serving their sanctions. So they could start at jail, move to the work center, be placed in a treatment facility, be placed at home if that's considered appropriate while they're serving their sentence. And those are things that we can do to make sure that we have the right intervention for the client based on where they're at and what they're presenting to us. We're looking to have 31 parole and probation officers. It will require some hiring because we did have an increase in our population over the last year. Within those 31 probation officers, we have some specialized caseloads. Domestic violence caseloads where we have cases that are marked by intimate partner violence and family violence, more often than not violence against women. We have sex offender caseloads where we have specified strategies for working with sex offenders in our community. We have geographic caseloads where we go out and try and intersect with the community and find ways that we can help stabilize people in their own homes. And we have a reduced supervision unit for those clients who pose the lowest risk to recidivate, knowing that we can maximize our value by focusing on the other higher risk folks when necessary. Within that, we have a measure of 57 caseload. We have specialty court caseloads, a mental health caseload for people who have been struggling or living with mental health issues in our community, reentry caseload for people coming back from prison, and we're able to collaborate with MADGE with the Medford Area Drug and Gang Enforcement Task Force to make sure that we are working collaboratively when enforcement strategies are best indicated for particular clients. Should also be noted that we use our CCA funds for administration and support to make sure all of this runs smoothly and we can create the type of infrastructure necessary to run this program. And we also use it to subsidize sex offender treatment, because while I mentioned we really like to have our folks pay their own way whenever possible, we don't want to have that. If somebody's barrier to treatment as a sex offender in our community is financial, we'll make sure they get that treatment that's necessary. So again, I want to spend a little bit of time talking about some of the unique programs and services that exist in Jackson County. I don't want to belabor transitional housing, but I put it first because it's one of the things I'm proudest of when I look at some of our colleagues throughout the state, and they're envious of what we can do to help stabilize people. It is not every county that has this commitment to its population, and it speaks highly of the dedication we have to try and restore our folks when possible. Corrections grade treatment. I use the term corrections grade because it makes it sound cool, like a Ford truck. But the bottom line is that there are certain characteristics that the criminal justice population has that aren't always met in the community by a health-based alcohol and drug treatment program. So if we can help them enhance those beds, if we can build collaboration those spots, and we can build collaboration between our partners, we have 120 spots dedicated to community justice clients right now for our formally supervised population. And it utilizes curriculum that is evidence-based to work with our population. And we have those kind of pieces built in so that we can get folks where they need when it's called upon. We have embedded mental health folks within our department. Again, when we talk about the things that are unique to Jackson County, we're not the only ones in the state that have that, but the list is short. So the idea that at the Transition Center, we have a QMHP, Stacy, qualified mental health provider, a master's level counselor who's certified as a specialist in forensic services, and she's also certified as an alcohol and drug counselor. So really, can I use the term unicorn? It's one of those people that you don't find very often that are able to do this work. She's dedicated to working with our population and working as part of our team. Down at the Parole and Probation Office, Community Justice Office on West Main, you will see another embedded qualified mental health professional who's used to working with criminal justice populations, who's on site. So if a PO is recognizing something with one of their clients that says, this person needs a little more help, they can walk them over and say, hey, this is Sarah, she's here to help. If somebody's in our lobby and they're in distress or they're having a hard time regulating, we also have a QMHA, a skills trainer, and that skills trainer or that QMHP can go out and engage that client right there. So again, the idea of real-time, qualified, and specialized care for folks in this setting is unique to what we do. The secondary piece is that our staff in community justice learn from those different expertises, learn from those different pieces, and it's been really a collaborative benefit to what we do throughout our department. We have the Resource Center. We had the Resource Center come and present, but the idea that people are planfully released from either the Transition Center or from jail with access to a number of different stabilizing forces, from DHS self-sufficiency, employment services through cutting-edge employment services. We also have our mental health folks are there, peer-delivered services from alcohol and drug specialists. We just have a full range of folks that are there to meet those people as they're released. I think the secondary piece is trying to extend the hours that's effective, so that if a PO has somebody that comes to visit them, that person doesn't have to make 6 spots through the community to help stabilize. They'll have one-stop shopping and have their needs met right there. We participate in specialty courts, so we have what we call rock court. If you call it drug court, people would understand, but the idea that instead of prison, people could utilize treatment resources on the front end here, stabilize, get well, and not utilize that prison bed, stay with their family. It's if you haven't had the opportunity, I would really recommend coming to one of the graduations and hearing some of the stories, because they all start kind of like this. Well, I wasn't really sure I wanted to do it. I was just kind of going through the motion, and then pretty soon I started to buy in and listen, and then before I knew it, I was actually going to group all the time and listening to this. It really is transformational. It seems to follow a pattern where people who are resistant to getting help reluctantly start, and once they start engaging, the results really are powerful, and it's some of the most powerful recovery we have in our community. It comes from our specialty courts. We also have a mental health specialty court. That's not funded through the state. We use a lot of local resources to make that happen. But those are folks who, but for their mental health diagnosis and their mental health concerns, would not probably be utilizing the criminal justice system to the extent they have. So to the extent we can minimize prison, minimize jail, and stabilize folks in their community, both of these models utilize a wraparound approach, a multidisciplinary team that kind of meets with those people and really tries to get them the services they need. Transitional care program, Mike again will speak to this, but that's that on-site residential treatment program out in Talent at the Transition Center. FSAP and Gender Responsive Services. FSAP stands for Family Sentencing Alternative Program. And it's the idea that if we have somebody who's the primary custodian of their child and they are looking at a prison sentence, if we can keep them in the community, stabilize them, often with the partnership of our local child welfare office, but stabilize that person, stabilize that parent, keep the family together. I mean, on the one hand, and this sounds a little crass, it's a tremendous cost savings for the entire system, but the impact that makes on that child's life, the safety it provides for our community, and the ability of many of these parents, and I'll be honest, a lot of them are women, a vast, vast majority that we work with in the FSAP program, the recovery we get there and the transformation it really is inspiring. And oftentimes it's because of that family component that they're able to kind of motivate before they can do it for themselves. So it's been one of those things where it's just been a win for our community. We're one of 5 pilot counties throughout the state that runs an FSAP program. They're going to be doing studies to see about really taking that out throughout the entire state so that all counties have access to that. And gender responsive services, the idea that women have very different needs within the criminal justice system that lead to their criminality, and subsequently there's different approaches that will lead to them exiting the criminal justice system. So finding assessment tools that work, finding case management tools that work, finding different approaches in terms of how we help women feel welcome, using universal precaution regarding trauma when we're dealing with women in our office. Eventually, we'd like to use that universal precaution for most of our clients, but right now it makes the most sense with our female population. But really, as a state leader within gender responsive services, I won't put you too much on the spot, Tira Hubbard, but Tira Hubbard's here, and it's been one of her passions that she's worked with extensively over a while. But getting to be a leader in that department really does mean a lot over the state. Employment for justice involved individuals. We carry a database that we've created with 192 partners in our community that are willing to hire people who are justice involved. We've often called them felon-friendly employers. And we have a list of what crimes they do and don't hire, what skills they're looking for, what hours they offer, what the background check process is going to look like. So it's consistently updated. We also have contacts there. So if I have somebody like, let's say Tina, that's justice involved, and they come to our office saying, I need a job, I can say, okay, Tina, go to Acme, wherever that is. I can call that person and say, hey, Tina's coming. She's got a resume ready. I think she'd be a great one. And because of those relationships, we're able to help people get employment at a higher rate. So we're very happy about those types of things that we can offer. The 2 pieces that we're really excited about coming on board in the next biennium, Project Match and peer-delivered supports. So Project Match is the medication-assisted treatment and confined healing. Really, we're a partner agency in this. Oregon Health Authorities contracting with the ARC, so the ARC will provide treatment services. We've got a local medical provider that can look to see whether or not medication-assisted treatment is right for that client as they stabilize. It will be people on supervision because we have the most ability to control the length of stay that person has, and then we can also move them when it's appropriate. So our goal is not just to say, here's 90 days in jail as you stabilize in a medication-assisted treatment program. It's to say, here's 90 days sentenced to jail or sanctioned to jail, but our goal is to get you into a residential treatment program as you stabilize. Our goal is to get you into supported housing as you stabilize. And the jail's dedicated 4 beds for men and 4 beds for women to this effect. We'll have a PO dedicated to that process, and we'll make sure we work closely with treatment and other local providers so that we can transition people effectively. Other efforts throughout the state have often lacked that transition piece, that next step once they leave the jail. We're confident, we're optimistic about our ability to build those supports within our community and see people succeed. Peer-delivered supports, we're basing this on the research. Although it's been in effect in some communities since 2004, people who are way ahead of the curve. But you'll start to see counties now that are really looking at people with lived experience as extremely effective at engaging people in the treatment process. I've said this, and I believe it, that the first step it used to be when somebody came into your office and that person was clearly suffering from addiction, and they'll use a term like tore up from the floor up, we'd say, oh, get that person to treatment, refer them to treatment right away. And sometimes that's appropriate, but sometimes when a person's really hurting and they're at those beginning stages of motivation, a peer could be the most effective tool at helping them, A, get to treatment eventually, but stabilize and really commit to a different way of life. So we're looking to have on-site peer-delivered services and case management. The other piece they'll do, besides just that one that I mentioned, is when a person is starting to rebuild their lives after being, running around through the jail or running through these different processes that often come with criminality, there can be a lot of stops in the community. So if we've got somebody to help them navigate that and identify the different things they can do more effectively, or even just support them as they go to the Social Security office, go to get their driver's license, we're really optimistic, or the research is really strong in terms of what the outcomes are for those people at staying engaged and completing their plans. They'll also be engaged at the Transition Center in delivering skills and helping people develop transition plans, as well as having drop-in services available for people at the Parole and Probation Office at Community Justice. So I know that's a lot coming at you, but I really am excited about the full array of services we provide in this county, just the number of things we're able to do. A lot of it's because of collaboration. A lot of it's because of the investment that our county makes in this. Every county gets their CCA allotment. Not every county chooses to really devote resources to this. So we're excited about that piece going forward. Yeah, Jennifer.
I have two questions around resourcing, if you don't mind. At the start, you said it's a bit disproportional to our percentage of individuals, right?
Yeah.
Across the state. And I can't remember from the previous one if that has changed or if that proportion is, the percentage that we're getting in this county stays the same.
Good question, because I have the answer. So in our previous biennium, we were at 5.6%, 5.62 of the state population of supervised clients. Currently, we're at 6.88% of the supervised clients in the county or in the state.
And what about the percent of funds that this county is pulling down through this?
That's the proportional amount.
That's
of
the
funding.
proportion.
Yeah,
I hear you.
that's
Okay.
But Eric, do
Yes.
clarify.
Yes.
That doesn't mean our population actually grew
Right.
necessarily. It's a percentage of the statewide caseload. So if other counties went down, we could have stayed exactly the same, but our percentage of the caseload went up. So it's not necessarily that we have more people on supervision, although in our case, we do have some more people on
Right.
supervision, but there's multiple factors that go into it.
Right, and that's really well put. It's looked at as a pizza, and what's your slice of the pizza? Pizza can either grow or shrink on a state level. Your slice can either grow or shrink as a proportion of that pizza.
So then I had a follow-up around resourcing. I heard in here new hires around parole and probation.
Yes.
Are there any other new expenses in the plan for this coming biennium?
Yeah, the project match and the peer delivered supports reflect that, and then there are also some increases in just the general cost of of doing business with staff cost increases throughout that. Right. Yes, Mayor.
Who are our major collaborators?
Right. We've been able to build those correctional grade treatment beds with the ARC, so the Addictions Recovery Center has been there for us. We've been able to work with the jail collaboratively to make sure we have the right people going in and out whenever we can, which honestly, if we didn't have that partnership, I couldn't imagine any of this being possible, because with constricted resources, it really makes a difference to have that level of everybody rowing together. We have employment services on site that are delivered through a local contractor. We have, DHS self-sufficiency. Jackson County Mental Health deserves a lot of credit for this, because they're the ones who've said this population is important to us, and this is the forum in which we believe we can really make a difference. So we're really happy to be able to build on those ones.
Eric, let me add just a little bit. Sure. So this particular proposal is specific to Community Corrections Act funding. And Eric's talking about programs that fall within that stream of funding. But Eric's department is a whole lot larger than that. So, and I just don't want to leave this, I don't want people to get kind of myopic about this is all you do, because if you take juvenile, then we're working with the nurturing center, we're working with DHS, we're working with
the schools,
on track and foster parent placements, and so we have a huge array with the whole department of partners that we work with.
Thank you, that's helpful.
I'd make a motion.
So a motion to approve this for recommendation to the Board of Commissioners?
Second.
We have a second.
Eric, before we take
sure.
a vote, I just want to say something. You know, I obviously am out in the community a lot. Some people know that this is how I started my career working in this field for 15 years. A lot of the things Eric talked about we delivered, I brought to the county, which I'm very proud of. And it's kind of disheartening to hear some of our public talk about all of the things that we don't do to try to help offenders. And we could pick one thing, the transition center. Eric, how many other counties have a transition center?
I think we're down to 4 in the state, 3 in the state. Okay. There's us, Marion, and
So the reason why we have that huge resource that has 165 beds and housing available for people that are unsheltered or homeless or whatever term you want to use is because the county invests in those things, and we see that as an investment to deter people away from prison and jail and more costly options. And Eric, I'm glad you took the time to actually go through. This isn't even everything that we do, but when I hear people complain about all the things we don't do, it seems to me that people are generally really uninformed when they make those complaints, and they almost seem to not believe that we're actually doing these things. And it's kind of our job, as everybody around the table who sits on this Public Safety Coordinating Council, to be the voice to those people that we're here to represent. And so, you know, I know everyone here knows this, but maybe everyone doesn't here know this. All of the mayors in the county select a mayor to represent the mayors. And it's the mayor's responsibility to report back to the mayors what they've learned about PSCC. And the same thing with many representatives that are here and the reason why we're here. And so I'm just encouraging everyone. This is a small piece of what community justice does, but we're having a big community discussion about the need for a jail or not the need for a jail and what services we have and don't have. I'm encouraging everyone to get out there and share what you've learned today about all of the things that we do in the county.
Thank you, Dan. I think that's really well put. So we have a motion and a second. All in favor? Aye. Opposed? Another biennium of CCA plans. We'll recommend that to the board for final approval. We did have a number of folks from Community Justice speak to the Sheriff's Advisory Group about a week ago. We went a little more in depth into the programs, and honestly, the people who directly deliver them, they add a little more spice to it, and there may be a chance to bring that back and actually share that a few more times, because it really does go into some of the details. It is pretty heartening, and one of the people who was there, and I'll put him on the spot a little bit, but Peter Buckley said, this is exactly what I needed to hear our county was doing to get me to the point where I can support some of these other efforts. So there's some good folks doing good things out there, and we'll work on getting that shared.